Hi, my name is Ulrich Hendriks. I'm 41 years old and I am from Kimberley. So, around about the 10th of March, I was in Uppington, Northern Cape, and I was busy. I was there for work. Got in contact with some Germans, and I actually joked with the Germans. I hope you guys are not bringing or infecting me with COVID-19. And we had a bit of a laugh, and it was like a 2, 3, maybe 5 minute conversation, and we went our separate ways. Came back to Kimberley. About a week later, I had some cold symptoms, fluish symptoms, and at the same time, my employer then sent out a questionnaire asking for if you had been in contact with high-risk individuals and if you have symptoms. And then things clicked. And I'm thinking, and after filling it in, it actually clicked, and I then informed my manager, and he said, I think you need to go home, and I think we need to start the process of isolation. Went for a test, and I really didn't expect it to come back positive. I thought, I just have a cold, but just to make sure that everything is fine, let's have the test. And when the test came back positive, the health services from work called to say you're positive, and I then called my doctor and had to make sure, and had a mini meltdown. I completely freaked out, called my wife, and then she freaked out. In terms of the symptoms, I had a runny nose, a bit of a cough. I didn't have a fever, but later, after a couple of months, because then they had done a bit more research on COVID-19, found out that I had a bit of diarrhea during that time. I found out that was probably one of the symptoms, and I've seen that they have actually included it now in the COVID-19 symptoms checklist. So yeah, it was bad. We got freaked out because we didn't know what to expect, because some people are asymptomatic, you don't even know it, but you spread it. Other people have a very bad cold, others go on ventilators, others die. So I wasn't sure where I would fall. It ended up that I had flu. I've had, in previous years, I've had worse flus than what I've experienced when I had COVID-19. Well, actually, I think the tiredness is actually one thing that about everybody's got in common. And you don't actually realize it because, the symptoms keep on expanding. So, like I said, with the thing with diarrhea, you only realize later that I was so tired because of this, because I normally wake up very early in the morning around 5, whether I'm working or not, and I was not working for about 2 weeks, and I slept just until afternoon, 8, and slept again. So yeah, I think the fatigue got to me, the isolation got to me, but then it was basically, and yeah, the diarrhea a bit as well. It was uncomfortable, but yeah, just the isolation and just not being in contact with people. My diagnosis was quite public because it was on TV and in a couple of newspapers, and so when our offices closed down because there was a positive case there, and it also made headlines, that then people sort of started phoning, people sort of started sending messages, and there were a lot of discussions on Facebook. Not all of them were supportive, but I understand at that time, COVID-19 in the Northern Cape was I think I was the third or the fourth positive case. So people were quite scared, didn't know what to expect. They were trying to crack their minds in terms of when was the last time I was in contact with Ulrich. Was I in contact with him during that time? So a lot of people were scared. So I don't really hold it against them. But I think as we all got educated in the past couple of months, we realized that you just need to keep your distance, wear your mask, practice good hygiene. But yeah, it wasn't. There were a lot of support from people, to say you've got it now. And there were a lot of people giving me advice in terms of how to boost my immune. So that was helpful as well. And when I eventually tested negative again, people were happy. Firstly, because I then tested negative again, but also that people saw that you can recover from COVID-19. So it's not necessarily a death sentence. You are able to recover, and so a lot of people were asking me on social media, on my phone through calls and WhatsApps, in terms of how can I boost my immune system, so that I can at least be a bit prepared. What was it like, that type of thing. So, but a lot of people found that, they found inspiration to say that it's not really, it can be bad, but it's not that, because I know someone who recovered from COVID-19. So if I'm positive, it's not necessarily a death sentence. Okay, so if you have been diagnosed with COVID-19, just please don't despair. Just stay positive, boost your immune as much as possible, listen to your doctors. Don't take possibly toxic medication that has not been tested. If it's traditional and it has been tested, use it. If it's something that your family or your people have been using for decades, do that. But stay positive. Adhere to what your doctors are saying. Don't even think about going out just to greet someone or whatever. If you're in isolation, be in isolation. If you don't have COVID and you know someone who has, just keep on supporting those people. We had wonderful friends, me and my family, who came, who would call us and ask us, what do you need? Because we were in isolation and quarantine, and who actually came and brought some food, left it at the gate. Who did shopping for us. So if someone has COVID and is in isolation or in quarantine, just try and do that kindness to them. Just even if it's just a bit of pudding or cake, just go drop it there at the gate. Try and be positive for them, because a number of us will eventually, according to the scientists, be infected or affected by COVID-19. So just be kind. It might be your neighbor, it might be your friend, it might be your parents or your sister who contracts COVID-19. So whoever it is, just be kind to them and be as supportive as you can towards them.